Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is January 20. Wisconsin's vaccine rollout has been going for about a month now, but there's still a lot of confusion over how that process is happening in the state. So to dig into all the specifics of what you need to know, how to interpret this data, is Will Cushman from our partners at WisContext. And Will, we want to thank you so much for joining us. Before we get into where vaccinations are heading, I want to cover what's been happening already for the past month. So who has been eligible for the vaccine and about how many people have been vaccinated to date?
Sure. So the folks that have been eligible since mid-December, that would be the people in phase 1A of the distribution plan. That includes frontline healthcare workers, as well as residents and staff at long-term care facilities. So the first group in that cohort included residents and staff at skilled nursing facilities. And the state is pretty close to wrapping up giving everyone in that group their first dose of vaccine. Yesterday, the Wisconsin Department of Health Services reported that about 89% of the population in that group had gotten their first dose of vaccine. And the state is now moving on to other folks, residents in assisted living communities and staff there as well. And then just on Monday this week, the state opened up vaccination for the first part of what they're calling phase 1B, and that includes police and firefighters. There's about 70,000 or so people in that group in the state. And then just yesterday, the state also announced that all residents aged 65 and older will be eligible to receive the vaccine beginning next Monday. I believe that would be the 25th. And in terms of how many—
And I want to ask you about that.
Sure.
Yeah. So how many people have been total vaccinated? And then for that 65 and older category, that's about 700,000 people. Do we have any idea as to how long it will take to get through that group?
Well, at our current rates, so right now, about 240-some thousand doses have been administered. About 40,000 people have gotten their full set of shots. So there's 40,000 people in the state who are fully vaccinated. This is as of yesterday. So that number is going to be a little bit higher now. And we also heard yesterday during a media briefing that they have been, in the last couple of weeks, there have been about 70,000 doses administered roughly each week. And so if we kind of extrapolate a little bit from there, this really large group of people, as you said, 65 and older, that's a group of about 700,000 people. And if about 70,000 people are currently being vaccinated per week right now, that group, it just alone itself would take about 10 weeks to vaccinate at the current rate. So I think the hope is that the vaccinations will be speeding up. Hopefully, we'll see.
So reasonably, someone who is in that age category, they heard this news, they're not going to be vaccinated next week necessarily. Maybe it might be a couple of months. So if you heard this news, you're in that category, what should you do in order to find out what steps to take?
Yeah, that's a great question. Yesterday, the Assistant Secretary for the Department of Health Services, Julie Willems Van Dyke, offered a little bit of advice for people in this age group. She said to think a little bit about getting your COVID vaccine like you would your annual flu shot. And so turn to whatever venue or provider you usually go to get your flu shot to inquire about a COVID vaccine. So whether that is your pharmacy or your healthcare provider, your doctor, a lot of people get vaccinated actually at their place of work. There are other places as well. Community clinics, local health departments also provide shots. So she advised that people start there and inquire just kind of the typical route that they would go about trying to find a flu shot. She also advised trying to do that as much as possible online if you have internet access. If you have a MyChart account through your healthcare provider or some other means to contact your pharmacy or your employer, what have you, she recommended going that route rather than trying to get on the phone. As we heard yesterday, quite a few reports about phones ringing off the hook at pharmacies all over as people who are rightfully anxious to get vaccinated are trying to figure out when and where they can actually do that. And you're right, it's looking like that age group will be eligible to receive the vaccine starting next Monday, but the vast majority of people in that group are not actually should not reasonably expect to get the vaccine next Monday or even next week. Probably it's going to be probably later in February or March.
And speaking of these categories, so we are in 1A, we are heading towards 1B. Julie Willems Van Dyke said, think of it like boarding an airplane. Once kind of zone 1 has begun to kind of trickle in the line, then you start boarding the next zone on the plane, and they decide these categories based on who's at risk, available doses, CDC guidelines. The state's advisory committee just this morning added food workers and bus drivers to phase 1B. And so that's along with teachers, childcare workers, prisoners, and more. So total, this category would be about 1.6 million people, about a third of the state's population. Is this going to take a long time, and is this going to be confusing?
I would say yes and yes. It's going to take definitely some time to work through that population. As you said, that's 1/3 of the state residents in Wisconsin would be eligible in this phase 1B. I'm based on how the rollout of this phase 1B has gone so far, kind of in a stepped approach. I imagine that those groups, those categories of people that you just mentioned will be eligible to be vaccinated kind of at various points in the spring, hopefully. And as you said, Julie Willems Van Dyke talked about this a little bit. Think about it like you're boarding a plane. There's these there's zones and groups, and usually they'll start boarding a zone before like the previous zone is completely boarded, and they're doing that with the vaccine rollout as well. They're making people eligible for the vaccine before everyone in the previous eligible group was vaccinated. Just that's in terms of the goal there is just to get shots in arms as quickly as possible, but they're also trying to be methodical about it. And as you said, weighing the relative risks of folks. We know that older people are much more susceptible to serious disease and death, so that's why they're among the first to get vaccinated. And then, those essential workers who really cannot work from home, who are daily likely potentially exposed to the virus, they'll be next. But we should be thinking about, just for instance, myself, the way I'm thinking about it is I'm a 32-year-old, relatively healthy person, and I'm not expecting to be in any of the phase 1 categories. There's also going to be a phase 1C. I'm expecting to be in just like the phase 2, which is the general population. And I'm invited to 2 weddings this year. One is in May and one is in September. I am definitely not planning to be vaccinated for that wedding in May. Which will be disappointing. And I'm really hoping, crossing my fingers, that I will be vaccinated in time for that wedding in September, and that plenty of other people will be too. And we'll see, though. Depending on how things go, if vaccination goes at the rate it's been at for the last couple of weeks, it'll take a year to get through the population in Wisconsin.
And it sounds like having a more kind of conservative frame of mind in terms of when every single person is going to get their shot is a little bit more of a realistic frame of mind. But with that, as we are opening more categories and that population is expanding, we found out recently that what we thought the federal government was doing in reserving vaccines for a second dose, and governors were calling for the federal government to release those doses, they actually don't exist. Is there a risk of not having enough doses for people as we are expanding these categories?
Yeah, I think that's a real risk. Governor Evers called it a slap in the face when he found out that this reserve of doses that was supposed to be held kind of in a stockpile in the federal government, as you said, withheld for second doses for people no longer existed. It had already been depleted. I think just this week, the number of new doses that were allocated to the state was actually about 10,000 doses lower than the previous week's allocation. So we're maybe already seeing a bit of a plateau in the availability of doses. I think the hope is that won't last very long. There are a couple other vaccines on the horizon that are not yet approved for use. There's one from Johnson & Johnson that I think will hopefully be approved here in the next weeks or month or two. That's just a single dose vaccine, so that could be really helpful. And then there's a couple other vaccine candidates that are also looking pretty promising. So assuming that those come online, that will help kind of alleviate this bottleneck. And then also President Biden, who just took the oath of office minutes ago, I think this is obviously one of his top priorities entering office. And he has a plan that he would like to include invoking the Defense Production Act to help speed up the production of vaccine and vaccine supplies. So if that all goes how they're hoping it will, that would hopefully help speed up manufacturing and distribution of doses as well.
And so we've been hearing from state Republicans. They've been very critical of the state of Wisconsin, specifically Democratic Governor Tony Evers and his administration for a failed vaccine rollout, but the State Department of Health just keeps saying we need more vaccines. Is there a disconnect in what those two are arguing? It sounds like we just really don't have enough vaccines, or are we sitting on some and these shots are not getting into arms and vaccines are sitting on shelves?
Right. Yeah. And this gets into just how kind of difficult it is to keep tabs on the number of vaccine doses that are anywhere at any given point. I've been keeping track of the data that the CDC publishes, as well as the data that the Wisconsin Department of Health Services publishes related to the number of vaccine doses that are allocated. So each state and territory is allocated a certain number of doses based on their population every week. And then also the number of doses that are actually distributed. There's been some confusion about what distributed actually means because a good number of those doses at any given time may not actually be in Wisconsin yet. They may still be en route from the manufacturers. So that's been kind of an area of confusion. And then, also is just the number of doses that are actually administered, the data that's kept by the CDC and the Wisconsin Department of Health Services, pretty much on a day-to-day basis, they do not line up. Wisconsin's data tends to be, I think, a little bit more up to date, and the CDC is behind reporting those shots in arms. And I think that is where some of the criticism of Wisconsin's vaccine rollout originates, because the CDC is also collecting and publishing data from every other state. And I'm not sure how up-to-date its data is from every state, but its numbers from Wisconsin being out of date it appears like fewer people have been vaccinated or received their first doses than is actually the case. Even with that, Wisconsin is a little behind middle of the pack in terms of the percentage of state residents who have received a first dose. It's about 3% right now. But I think that's where some of the criticism is originating. But then I've also heard criticism both in reporting, in stories I've read, but then also hearing from people directly, criticism of just the communication surrounding the vaccine distribution and rollout and plans and where people can get their vaccine and when. I think there's been quite a bit of confusion. I think the Department of Health Services, I think, is understanding of that, and like they're actually they've really beefed up the amount of information available related to the vaccine program on their website. They're now sending out a weekly newsletter to provide updates and providing more frequent media briefings about the status of vaccination and who's eligible and how they can go about getting the vaccine. But I think that was certainly in the first month of the rollout an issue. The communication was.
Yeah, and it's difficult to remember. It's only been a month, and based on what you said, it is very difficult to compare one state to another, and then every state to every other state. But overall, it sounds like there's a number of reasons why things have not been going quite as fast as we would have liked them to. There was an original projection of by fall of 2021 that we would achieve some sort of herd immunity, which is above 80%, but it sounds like we are not going to reach that goal, and that is a reality for a number of reasons.
Correct. Yeah, at least that goal is looking quite not super achievable, especially at the rate that we're currently vaccinating. Again, anything, I don't want to say anything with too much assurance because a lot of things are changing really rapidly right now related to certainly the federal government's response to the pandemic and to vaccination. But yeah, as it currently stands, early fall is looking extremely optimistic for having 80% of the state population vaccinated.
All right, well, I'm sure we will be connecting with you again in the future as you are keeping an eye on this data very, very closely, and just want to thank you for sharing with us what you know today.
Happy to. Thanks, Marissa.
For more from Will Cushman and WisContext and all of the data, including a lot of really amazing visualizations, you can visit wiscontext.org. And you can find more from Here and Now and PBS Wisconsin at pbswisconsin.org. And thank you so much for joining us on Noon Wednesday.